Hello, dear ones. Welcome to this very special space dedicated to wise aging, sexuality, and health. Today, we are going to dive into a topic that, although sometimes difficult to discuss, is an essential part of male health and overall well-being. I want to begin with a question that you might never have considered, but one that could significantly change how you think about your body or your partner's body. Did you know that the frequency with which a man masturbates can directly impact the health of his prostate? You might be raising your eyebrows in surprise, or perhaps you've heard this before. Either way, don't worry. We're going to explore this topic with respect, curiosity, and a wealth of evidence-based information. Before we delve deeper, I want to make something clear from the outset. This discussion is primarily aimed at individuals over the age of 50 because these issues become increasingly relevant as we age. I will be sharing insights from my experience as a medical doctor and sexologist, but also from the heart, because I firmly believe that an active and conscious sexuality is synonymous with health, well-being, and vitality, regardless of age. Talking about masturbation in old age is not a trivial matter. It is an act of self-care, a way to connect with oneself, and a means to maintain sexual and emotional health over the years. Sexual health is an integral part of our overall quality of life. Now, let's focus on the prostate, that small organ roughly the size of a walnut, located just below the bladder and surrounding the urethra. The prostate plays crucial roles, such as producing part of the seminal fluid that helps transport and nourish sperm. However, as the years pass, the prostate can start to experience issues like benign prostatic hyperplasia or even prostate cancer. So, the key question here is, how does masturbation affect prostate health? Let's break it down step by step. Numerous studies suggest that men who ejaculate more frequently have a lower risk of developing prostate cancer. For instance, a study conducted by Harvard University analyzed more than 30,000 men over an extended period and found that those who ejaculate at least 21 times a month had a significantly lower risk of developing prostate cancer compared to those who did so less than 5 times a month. This can be attributed to several factors. First, ejaculation helps release potentially harmful substances that accumulate in the prostate. Think of the prostate as a small factory. If this factory produces but does not release its products, there can be an excess of material that could be harmful. Frequent ejaculation helps clean this factory and keeps it functioning healthily. Additionally, this process helps reduce the occurrence of inflammation, as the stagnation of prostatic fluid could facilitate infections or discomfort that, over time, could affect the quality of life. Moreover, regular masturbation can also help reduce prostatic inflammation, relieve stress, and improve blood circulation in the pelvic region. All this contributes to keeping the prostate in good condition. Think of it as a kind of prostate exercise, a way to keep that small but important organ active. These practices not only benefit the prostate, but also contribute to greater body awareness, better stress management, and a general sense of well-being that can extend to other areas of daily life. But what about men who do not masturbate frequently? It's important to be clear and objective here. The lack of frequent ejaculations does not necessarily mean that a man is destined to have prostate problems, but it could slightly increase the risk of inflammation, prostatic congestion, or the development of long-term conditions. By not regularly releasing prostatic fluid, there could be a stagnation that favors the growth of bacteria or the appearance of discomfort. This stagnation over the years could lead to prostatitis or other discomforts that directly impact the quality of life. When it comes to erections, there are notable differences between men who maintain constant sexual activity, including masturbation, and those who do not. Erection, in simple terms, is a vascular and neurological response that depends on good blood circulation and an adequate response from the nerves. Regular ejaculation can help maintain active blood flow in the pelvic region, which promotes firmer and longer-lasting erections. Maintaining this activity can act as a kind of training that preserves erectile function, partly preventing the dysfunction that can appear over time. Conversely, men who ejaculate less frequently may notice a progressive decrease in the quality of their erections. This does not mean it is irreversible, but it can imply less elasticity of the blood vessels, which affects the firmness and duration of erections. Lack of sexual activity can lead to a gradual loss of sensitivity and a lesser response to stimuli, which, added to other factors, can increase the incidence of erectile problems over the years. Now, I want to add another fundamental point. Masturbation, in addition to its physical benefits, also plays a key role in emotional well-being. As we age, concerns about sexual performance or the fear of losing sexual abilities can generate anxiety. Regular masturbation allows men to maintain an intimate connection with their bodies, reducing the stress associated with these thoughts and improving sexual self-esteem. Additionally, the release of endorphins during masturbation can help combat depression and loneliness, two problems that often affect older people. In short, it is not just about physical health, but also about maintaining emotional and mental balance. It's also worth noting that sexual health is not just about the physical act, but also about the emotional and psychological aspects. Masturbation can be a form of self-exploration and self-discovery, helping individuals understand their bodies better and what brings them pleasure. This understanding can translate into better sexual experiences with a partner, as well as a deeper appreciation for one's own body. Furthermore, maintaining an active sexual life, whether through masturbation or with a partner, can have profound effects on overall health. It can boost the immune system, improve cardiovascular health, and even enhance cognitive function. The hormones released during sexual activity, such as oxytocin and dopamine, contribute to feelings of happiness, relaxation, and bonding. In conclusion, the benefits of masturbation extend far beyond just physical health. They encompass emotional, psychological, and even social well-being. It is a natural and healthy part of life that should be embraced and understood, rather than stigmatized or ignored. And with this, we come to the end of today's talk. I hope this information has been useful and has opened a window for reflection. Let's remember that self-care has no age, and talking about sexuality in old age is talking about health and well-being. If you like this video, don't forget to subscribe to Wise Aging, Sexuality, and Health and share it with those who can benefit from this knowledge. Until next time, and remember, your well-being is the most important thing.